Hello, friends and family. Have you ever wondered what an open bite is, or have you ever heard the term open bite? Today is what we're going to be discussing. So, what's an open bite? An open bite, you can notice it when you see that your top teeth and your bottom teeth, your front teeth, that is, they're not meeting, right? So you have an opening between your top teeth and your bottom teeth when your mouth is closed. So you're biting, but your front teeth do not meet, the upper ones and the lower ones. That's an open bite. So you may wonder what are things that can cause that to happen. Why? Because, somebody with an open bite, for some people, actually, it's not very aesthetically pleasing, right? So, and that's some of the reasons why people, seek out treatment to kind of correct things. So, what causes it in the first place? What can be done in order to prevent that from happening? So, I want to discuss some things that can actually cause open bite to happen, or that can create open bite. So number one, when your child is a baby, some kids have the tendency of sucking their thumb, right? Or sometimes they suck on a pacifier, or sometimes, they kind of like suck on the the tongue. So those are habits that can actually cause open bite to develop if it's prolonged, if it's done in a prolonged manner. So when a baby is a baby, it's okay, for the child to maybe suck on the thumb, but there's an age at which you want to actually prevent that from happening. So from what we hear, it's like around 2 years or so, you want to now refrain, your baby from either sucking their thumb or their fingers, or using the pacifier, or even tongue thrusting. Why? Because what happens is when the baby actually sucks their thumb, and they do that for comfort, right? So it applies like a pressure on the palate, and that brings them comfort. But what it does is it puts too much pressure on the upper teeth. And so now, the teeth can start getting splinted. So instead of them contacting like this, they start like shifting in this manner. And then it ends up creating an open bite. It's the same thing with a pacifier. When a baby is taking a pacifier, it also puts some pressure on the teeth, and also can cause, that splaying effect. And we see that on many babies. With some kids, it happens early, where, you see that the palate becomes more narrow and the teeth becomes more flared. And oftentimes, either when we do the exam, we'll notice that, the baby coming in the room for the exam, the baby sucking the thumb, also did some digits, because it's not only the thumb, that can create that, but any digit sucking. Also, when they are so into the pacifier. So that's why, after a certain age, you want to kind of like deter them from keeping on sucking on the pacifier, because it can create problems. Now, another thing, as I said, that I mentioned was thrusting their tongue. So they kind of like playing with their tongue towards, like, their tongue is like going in and out, like thrusting their tongue. And that can also put in some pressure on the teeth. Because believe it or not, like, the tongue is actually the strongest muscles in the entire body. So slowly, little by little, it actually creates that the pressure progressing, actually slowly can create an open bite. So open bite vary in size. You go from, slight open bite to moderate to severe. So you will see, for example, that, some people, when they bite, you can see just like a slight opening. Or with some people, maybe they're not able to, when they want to like incise or something, or bite on something that is very thin, they can't really exercise some pressure. Or some people, a cigarette can go through their teeth, and some more severe is even more, right? So that's kind of like the level, how we kind of like gauge an open bite. So it varies. So now the question is, why is it even a problem? right? Why is open bite a problem? Well, number one, aesthetically, right? May not be aesthetically pleasing when you smile and you have space between your teeth. So that's number one. Number two, it can cause, especially if you're a mouth breather, right? Your mouth to become more dry. And so, when you have an open bite, you have more air, getting in your mouth and just drying your mouth, drying your teeth, and you can become more like cavity prone and things like that. Or even, because you end up having like a dry mouth. Another thing is that, every teeth have a function. And so now because you're not able to, your teeth are not able to function properly. So now you're using other teeth to compensate from the function of the front teeth. So the front teeth are meant to actually bite on the food. So now you're not able to bite on your food. And so now you're using other teeth, maybe like, your canines, or you're using your molars or your back teeth in order to kind of like incise. So more wear and tear on teeth that were not supposed to function as such. Okay, so that can cause more flattening of your teeth. It can even end up causing you, because you're using too much, or even your teeth are not positioned well, you can end up having even TMJ issue. Also, you start having pain on these joints over here, right? It can also even lead to breathing problems. So there are so many things that can actually happen beside not having an aesthetically pleasing smile. It can cause you to have a long face syndrome. And so there's so many things, that can occur from, having an open bite. So, right, the number one thing to do is, when the child is growing, at about 2 years old, you want them to stop the digit sucking or pacifier sucking, or even, discourage them from thrusting their tongue, which is a little bit more challenging. If it's not really working, you can go to a dentist, and a device can be created to refrain or to deter or discourage the child from sucking on their thumb or their digit, or like on, some other people do, they maybe like biting on pencils, or, on pens, chewing on things that are not, to be chewed on, exercising more pressure. Of course, there are some things that you can use over the counter. There are some things that you can put on the fingers of your babies that taste really bad, and that can prevent them from doing so. In fact, they even nowadays sell like some gloves that would cover, some of these digits. And then, it's not as comfortable if you're sucking, if a baby is sucking on their thumb, and like they made like a piece of cloth, so that can like refrain them from sucking. Some, there's put like something that have a very bad taste on their finger, but they just suck on it, spit it out, and there they go, being comfortable again. So that's, those are cases where you can go to your doctor, and a device will be created that would kind of like put a barrier, so that they are not able to actually suck on on their fingers. And that can be done when you go to your dentist. So definitely, if the baby is not able to kind of like break that habit, you want to talk to a dentist. There's another thing that can be done, is going to fix the problem. Orthodontic treatment, meaning braces or clear aligners, can actually put the teeth back in realignment, so that that open bite can be fixed. Okay, in very, very more severe cases, someone may need to go through surgery in order to realign their jaws. Okay, so we don't want to get to that point. If it's something that can be fixed when the child is still young, or, prevention is always better, that's the best thing to do. But, if the if you already have an open bite, it can be fixed. It's not a fatality. There are treatments that can be done to fix the problem. Okay, so that's what I wanted to talk to you about. And if you know someone, or you have someone that has a child, or you have a friend that has an open bite, talk to them about this, what you heard today. And there is hope. Okay, there is definitely hope. It's not a condition that cannot be fixed, or it's not something that cannot be addressed. Definitely there are some things that can be done about it. Okay, so if you are in need of a great dentist, you are in need of establishing a dental home, and you are in the Dallas-Fort Worth area, please don't hesitate to contact us. I'm Dr. Valerie Mukanga with Healing Wings Dental, the place where we help our patients maintain and regain their oral health and their smile so they can soar in life. Okay, so we are here for you. If you're in need of orthodontic treatment, don't hesitate to contact us. We can either do braces with brackets, or clear aligners are also great options that can be done. Okay, so we want to steer you in the right direction. You want to give us a call, 972-213-0202, to secure an appointment, and we'll be able to give you an appointment in a timely manner. You don't have to go months and months and months. We can fit you in our schedule so we can start becoming part of your journey. You can also go to our website, www.healingwingsdental.com, and request an appointment. We'll be able to help you in that manner as well. Okay, so that being said, you have a great and a fantastic day today. Go and make it happen. We're rooting for you, and we can't wait to see you next time with more tips about dental health. Take care. Bye-bye.